Hello, my name is Dr. Shahid. I'm a general pediatrician and medical educator. And in this video lecture series, we've been talking about preventing burnout, developing resilience for doctors and medical students. Today's topic is going to focus on maintaining wellness during COVID. So let's go ahead and get started. So this is my overview of wellness and burnout. I see wellness and burnout on opposite ends of the spectrum. And if we can do things that will promote wellness, that will help prevent burnout. I divided up wellness into developing resilience and prevention of burnout. And there's a blue arrow that goes between the two boxes that indicates that there's overlap with each of these areas. And further, I divided up developing resilience into wellness dimensions and resilience strategies, and prevention of burnout into self-care and organizational strategies. And again, the blue arrows between each box indicates that there's overlap between all of these. So anything that you do for developing resilience or the resilience strategies not only develops resilience, but also helps prevent burnout. And if you do anything in the self-care category, that helps prevent burnout, but also helps develop resilience. So there's overlap between all of these activities. And this is not an all-inclusive list. This is just how I view overall wellness and resilience and burnout prevention. But all of these have been shown to be effective in developing resilience and promoting wellness and decreasing the risk of burnout. So again, there's overlap between each one of these, and we're going to talk about a few of these strategies specifically. So with the focus on how they can be used to maintain wellness during this COVID pandemic. So let's go ahead and talk more in detail about some of these areas as well then. So the first thing I want to highlight are the wellness dimensions. So there's different wellness dimensions. There's the emotional wellness, there's physical wellness, there's social wellness, intellectual wellness, spiritual wellness, financial wellness, environmental wellness, and occupational wellness. And we have to do things that will maintain wellness in all these areas, and that will allow us to develop resilience and promote our wellness in our effort to prevent burnout. And there's different definitions, and there's different wellness wheels that are out there that you can look into. So this particular wheel divides it up in those same 8 categories, and then it talks about the definition of each one of those categories. So in order to promote wellness, we have to look at each one of these areas, each one of these components, and try to do activities that will increase our wellness in each one of these components. Now, with the COVID pandemic has really impacted in a negative way all these areas of our wellness. So there's so many different ways that the COVID pandemic has had a negative effect on our wellness and each of these components of our wellness. We'll kind of go through some of these and then get back to how we might be able to move forward and promote wellness as well. So how has COVID-19 challenged our wellness? I don't know about you, but I've felt this low-grade level of stress and anxiety that's kind of present at all times that was not there before the pandemic started. Now there's this just kind of this low-grade level of uncertainty, of stress, of anxiety that's kind of always there as a baseline that was never there before the pandemic started. And I think now our baseline level of stress and anxiety is a little bit higher. And then anything else that comes our way, any other type of distress and difficulty and challenge really has a negative impact on us. And this low grade of stress and anxiety might be due to the fact that so many people are having personal and family health issues and concern about the safety and health of their family members. Many families are facing financial insecurity because of furloughs and layoffs and job situations. So many people have been forced to work at home, which might present its own challenges and stresses. A lot of the schools are closed, so the kids are being schooled from home, which again brings on new challenges and new stresses of Wi-Fi and internet access, and computers and tablets and devices that are available, and the quality of the education. So that's adding to the stress and anxiety that we might be facing. I mentioned the furloughed coworkers and layoffs and job cuts. and then all the changing recommendations from our public health officials, and the uncertainty of what's happening and how it's changing, and trying to keep up with that. And then maybe this anxiety and stress of what we hear about, where people end up dying alone when they have COVID, and there's no visitors allowed in the hospital. So maybe these are some of the reasons why we all have this low grade level of stress and anxiety that's kind of there as our baseline now, and that's, I think, really has challenged our overall wellness, and are putting us all at risk for increased rates of burnout. Other things that might have happened, there's all the stay-at-home orders and social distancing, and and we know in the spring there were lots of changes that took place, where the match day celebration that we have here in the U.S. For the graduating medical students to know where they're going to do their residency, that was canceled. Graduations were canceled. We haven't had an opportunity to have the parties that we were hoping for, and the weddings and the anniversaries and the birthdays, because of social distancing or stay-at-home orders. Not being able to visit family and seeing kids, or grandkids, and seeing parents and grandparents, that has added to the stress, and challenged our wellness. Socializing with friends, going out to eat, seeing a movie, being able to participate in religious gatherings. So all of these things have been limited, and I think this has really challenged our wellness during this pandemic, and is putting us at increased risk for burning out. And I think that's why it's so important to recognize this, and understand, and think about how we can promote our wellness, and promote our resilience to get through the challenges that the COVID pandemic has presented. As a healthcare provider, there's also many things that that are being faced by the healthcare providers. So if you're a physician, a medical student, a nurse, or any type of healthcare provider, that there's increased patient volumes, especially in the COVID units and in other parts of the hospital. There's this uncertainty about the nature of the illness, although now 8 months into the pandemic, we have a little more understanding of the illness and the severity and morbidity, but there's still unexplained parts of the illness that we're still trying to learn about. The incomplete and changing medical information that I've alluded to, fear of our own mortality, seeing colleagues and coworkers develop COVID and then succumb to the illness. Again, interacting with the dying patient, that's one of the most stressful things that that can happen. And you hear about so many stories of healthcare providers, of doctors, of nurses, of respiratory therapists, of other healthcare providers, where they're the only ones in the room as the patient is dying of COVID, and the stress that causes, and the grief that causes. Or the nurse or the physician is using their phone to FaceTime the family of that patient as they're dying, knowing that that's the last time that they're going to see their family, or that they're watching their loved one pass away, and the family cannot be by the side, and only you as a physician, you as the nurse, you as the healthcare provider are the only one in the room, and being that liaison for the family. So that's very stressful. That is very challenging, and I think that has really made a huge impact on the risk of burning out of healthcare providers. Compassion fatigue, right? Trying to maintain empathy and compassion, and just working so hard, and knowing that there's going to be bad outcomes, you get fatigued with that. And then lack of PPE and medical equipment and resources, and and gloves and face masks and gowns, and the challenges of that. And then this healthcare providers many times have this guilt or sadness, and the fatigue and anger and moral distress about not being able to do the best for the patient, and not to be able to save their patient, and making very difficult decisions about who gets a ventilator and who gets a certain type of treatment. That can be very, very challenging to our wellness. So again, COVID and this pandemic has really challenged our wellness, and really affected our wellness in a very negative way, and put us at risk, especially as healthcare providers, to burning out. So now the question is, how can we move on from this? How do we move forward from these challenges, and develop wellness, and develop resilience, and get us through this difficult situation, difficult time? Again, in other issues related to medical education, whether it's undergraduate medical education or graduate medical education, so for students or for residents, a lot of different challenges. Again, coordinators working from home, the orientation process going virtual, doing interviews for residency or for medical school virtually, visiting students, not being able to do electives and audition electives at other facilities that they might be interested in working in the future. Telemedicine issues, telehealth issues, and the safety and health of our learners, and the wellness of all of our colleagues, our residents, our students, our coworkers. So again, all of these have been challenges to our wellness that COVID-19 has really pushed us into. And again, the question is, how do we move forward from this? How can we help us move forward now from this? And how do we develop wellness and resilience to all these challenges that we've been faced with suddenly? So I think this is a great quote that kind of sets the tone of how we can start to move forward. So resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it, you can do nothing but scream about what you've lost, or you can accept that and try to put together something that is good. So resilience is being able to accept your new reality, even if it's less good than the one you had before. That's an important concept, especially when it comes to the COVID pandemic, because we're in a new reality now, right? We are in a new world right now where we're wearing face masks, where we're socially distancing from each other. So it's all a new world. It's all a new reality, and maybe it's not as good as it was before, right? But we have to learn to accept it. So resilience is part of resilience is being able to accept that new reality, and not really fight it and not scream and yell about it and what you've lost and how it used to be and what we were able to do, but kind of accept it and then try to put something good out of it. Try to see it from a different light and try to see what good is coming out of it. And we're going to focus a little bit on that approach as we move forward then. So a few different resilience strategies that are very effective during this COVID pandemic are the strategies of positive thinking, reframing, and optimism. So we're going to talk about these three, and they kind of create a nice cycle, right? When you start thinking more positively, and then you can reframe things from a negative into a positive, and that creates optimism, and that leads to more positive thinking. So it's a nice positive cycle that's created, and I think these three strategies of resilience are very important to help us through this COVID pandemic. And these are on our overview of wellness and burnout, the diagram I referred to earlier, and they're listed here as these resilient strategies of positive thinking, reframing, and optimism. And again, let's talk briefly about these. So positive thinking and reframing. First of all, we have to recognize that our experiences really affect our thinking, right? Sometimes we have a positive experience, but many times we have a negative experience. And negative experiences can cause pessimistic thinking, and it could drive negative emotions, and can shape negative actions, and it could influence negative outcomes. And this leads to more negative experiences, and this can get into a cycle as well. So we have to keep this in mind because we all have a negativity bias, right? We all have negative experiences, and we really remember them more strongly. They're ingrained in our memories than the positive experiences. But unfortunately, this negativity then begets more negativity, and it can cause us to start thinking irrationally and think more persistently of negative things, and it could be a very destructive thought process. And we also know that it takes at least 5 positive actions to overcome 1 negative action, right? So we get stuck on something negative, and to get over that, it takes up to 5 positive actions to be able to move on from that and to overcome that. So again, we got to do something to break this negativity bias and these negative feelings that we have, and that's where the reframing and the positive thinking comes in. So the skill of reframing. It's basically learning to correctly identify your negative thinking, then answer that negative thinking back and say, okay, I recognize I have this negative thinking. I'm not going to do that. I'm going to change my thought process. I'm going to refute the negative thinking, and then I'm going to reframe that negative thinking by focusing on the positive. These are the steps of reframing, and these are very important to break that negative cycle and start to think more positively and focus on the positive. Reframing and positive thinking doesn't mean that we convince ourselves that a bad experience was good. It just means that we consider how the situation might look from a different perspective or a different angle. Just try to look at it through a different lens, and try to reframe it a little bit and see if we can find something positive out of that bad experience, something that can allow us to grow and develop and make something positive out of that negative experience potentially. So again, reframing the negative, one of the ways to do that is search for the opportunity in the midst of that adversity and extract positive meaning from that tragedy. Because when you can take something positive out of a difficult situation or out of adversity or tragedy, that really helps you learn and grow from that experience. And you become a better person because of it. And many times you learn things that you can then share with others so that they don't have to go through that same type of adversity or difficulty, right? You went through it, you learned about it, and now maybe you can talk to others about it and give them some tips so that they don't have to go through that same difficulty. So that's part of the reframing and the positive thinking, to be able to see things, extract something positive out of it that will allow you to learn and grow from that experience. Okay, when you have this positive thinking, it really ignites resilience, and resilience is really about having a future-oriented attitude. So it's a confidence that things will turn out well, right? It's the confidence to know that tomorrow, if today's not a good day or today things haven't gone well, tomorrow is going to be a new, bright, sunny day, right? It's looking ahead and it's being confident things are going to get better, things are going to turn out well. Optimism doesn't mean that you blindly ignore life's problems. You have something called realistic optimism. So again, you don't deny the difficulty being faced, but you tend to look for the silver lining, right? You look for the positive. You look for, some hope out of that. You look for that silver lining to be able to move forward from that and to feel confident that things are going to get better. Optimism increases the capacity to positively reappraise situations that initially appeared negative. And that's part of the process of reframing. And reframing allows that hardship to be seen as a challenge to find opportunity embedded in that adversity. So again, being optimistic allows you to take a negative experience and then reappraise it in a more positive way, and then reframe it in a way that will allow you to grow from that challenge and that adversity. Okay, so in order to be optimistic, we have to interpret events positively, meaning that when something bad happens, we have to remind ourselves that it will not last forever. It will get better, right? We have to stay hopeful, right? And we have to know that it's going to get better, right? I know right now with COVID, we're getting fatigued, right? We're getting tired of being told to wear a mask and to stay socially distant and not to travel and quarantine as needed. And we've been hearing it for months and months, and we're starting to have a little bit of fatigue from that. And we're thinking, when is this going to ever end? Is it ever going to end? But yes, it will end. We have to have hope. We have to be optimistic that it's going to get better. It's not going to last forever. It is going to end, right? And it's a marathon, right? This is not a sprint. So it's a marathon, and we're getting tired, we're getting fatigued. We don't think we have the energy to keep doing this and to keep moving forward, but we do. We have to be optimistic. We have to be hopeful, knowing that it's going to get better. There is an end to this right now with with this video right now. The vaccines are becoming available, and there's studies to show that they're helpful and that they're effective, and they'll be available soon. So there is hope. So we have to keep that hope and be optimistic. Other aspects of optimism when something happens bad is keep that adverse event within its limit. Don't let it pervade other areas of your life, right? Don't generalize and say that, oh my gosh, this is going to go on forever, or it's affecting other aspects of your life, right? Whatever aspect it's involved, keep it within those limits. Don't let it invade and pervade other aspects of your life. So keep it confined in that way. And then also think of strengths and resources that can help you deal with the problem, right? Think of your own inner strengths. How have you gone through difficulty before? And use that, right? And then use other resources, whether it's your support network, or whether it's family and friends, or whether it's faith and religion and spirituality, or it's other activities, right? Or if it's even if it's professional help, make sure you use all the resources that are available to you to help deal with the problem. Then also notice what is good, right? Just don't focus on the bad, right? Notice what is good. Think about things that are positive, think about things that are going well. So I think that's important as well, to stay optimistic when something bad does happen. So this is a study a couple years ago that looked at healthcare providers, and they asked the healthcare providers to write down 3 good things every day for 15 days straight. So they basically ended up writing 45 good things over these 15 days, right? So they were asked again at the end of the day, think about 3 good things that happened to them that day and write them down, right? And then what they did was before this intervention and then after the intervention, they were asked to take different surveys to assess their emotional exhaustion, their depression screen, work-life balance, and happiness. What they found was compared to baseline, when they did this activity for 15 days straight and they wrote down 3 good things every day, it had a significant improvement on their emotional exhaustion, on their depression, on their work-life balance, and on their happiness. 1 month after the intervention, 6 months after the intervention, and even 12 months after the intervention. So again, writing down 3 good things every day can really have a positive effect on your emotions and help develop resilience and maintain wellness. So that's something that maybe could be done during this COVID pandemic, is thinking about what are some good things that are happening to you every day, and trying to stay positive in that regard. So I'm going to ask you to maybe do a little self-reflection exercise. You can do it now, or you can do it after completing the video, where you're going to practice these resilient skills of positive thinking, of reframing, of optimism. So maybe taking a few minutes to be able to kind of practice these skills, right, through this little self-reflection exercise that I'm going to describe. So here's a worksheet, right, for wellness dimensions, right? So the wellness dimensions that we talked about in the wellness wheel are written on the side there, and their definitions. And then I want you to just take a moment to think about something positive, some positive effect that COVID has had on each one of these dimensions, right? So instead of focusing on the negative, right, we've been talking about the negative impact that COVID has had on all of our wellness dimensions. Let's use the skill of positive thinking and of reframing and of being optimistic, and use that resilient strategy to think about something positive that has come out of this COVID pandemic in each one of these dimensions, right? So maybe think about 1 or 2 things in each one of these areas and write them down, or at least think about them, and try to think about something positive that COVID has done as a result of the pandemic, something positive and good that has come out of it. Then instead of focusing on the negative, let's try to focus on the positive, right? So maybe it's the fact that your social wellness and emotional wellness has improved because because of social distancing. You're actually now using video conferencing and FaceTime to get in touch and in contact with people you have not seen or talked to in a very long time, right? Usually you see them once a year and you travel out, somewhere, and now you can't do that because of social distancing and travel restrictions and quarantine and things like that. So now you're using FaceTime or using video conferencing to get in touch with those people that you've kind of lost touch with, right? So that's a positive effect of COVID on your emotional wellness and maybe your social wellness, right? So let's think about, let's see, intellectual wellness, right? So let's say you've learned a new skill, right? Let's say you've learned how to cook, right? You've taken up some cooking classes or courses that you saw online, or you're trying to, you've learned how to cook on your own because restaurants are closing and it's you can't go out to eat, right? So now you've learned a new skill, so that's improved your intellectual wellness, right? And maybe the fact that you're cooking now at home, that's actually helping your physical wellness, because now you're eating more healthy. You're not eating fast food and running out to grab a bite to eat, but you're cooking at home. So that's also improving your physical wellness because you're eating more healthy. And maybe being able to cook at home because of all the restrictions is actually helping your financial wellness, right? Because you used to spend money going out and eating at a restaurant and spending money that way, and now you're actually saving money because you're not able to go to a restaurant and eat out, and you're actually cooking at home, right? So taking up the skill of cooking and cooking at home is maybe helping your intellectual wellness because you're learning new recipes and new ways to cook. It's helping your physical wellness because you're eating more healthy, and it's helping your financial wellness because you're not spending as much money on eating out then, right? So again, that's a positive that is coming out of the COVID pandemic, right? So these again are positive things that we need to be thinking about, and reframing some of the negative into the positive. So that negative is that, the restaurants are closed and we can't go out and we can't eat out, but you reframe it into the positive. By cooking at home, you get wellness in so many different dimensions then. So maybe now you're also working on your spiritual wellness, because now you have more time to kind of reflect on spirituality and your faith and your religion, and that's helping you get through the COVID pandemic, and it's helping you remind yourself of your connection with your own religion then, right? So that's improving your spiritual wellness, and you're using that. And maybe in the past you didn't use that aspect of wellness that often, but now COVID has given you the opportunity to use spiritual wellness as a means to get through the pandemic. So again, there's positives that we can be thinking about in each one of these wellness components and dimensions. So instead of thinking about the negative, let's try to reframe it, and let's try to think about the positive that is happening. So again, use that skill of reframing and positive thinking and optimism to help you get through the pandemic in this way. Okay, so let's move on from that part of the discussion to another part. Okay, the power of the pause button. I think this is so important, to be able to just pause our life and to reflect and to think about where we are, who we are, and where we are going. And the pandemic, especially early on, when it started in the spring earlier, 8 or 9 months ago, everything came to a standstill, right? We had lockdowns, everybody's working at home, everything was kind of shut down, depending on where you lived and where you were at. But in many places, things just came to a stop. Everything stopped, and that was the power of the pause button, right? Our life came to a pause. Our life came to a halt. And again, the positive of that was that we were able to we actually had time to think, to reflect, to reevaluate, to reassess, to reconnect with ourselves, right? Because we're so busy and caught up in our lives and just running around and doing our daily things, right? We don't have a chance to even just kind of think about things, right? And to think and to get to know ourselves better, right? We're so busy with other stuff. But the COVID pandemic, I think that's a positive that came out of it, that we all basically had the pause button was hit, and we had a moment to actually be more mindful and to think about things, to reflect on things, and to reassess and reevaluate our lives. So I think that was so important to be able to do that. And every now and then we need to be able to do that. We need to be able to stop and pause and think and reflect, and get to know ourselves a little bit better, and see who we are and where we're going and how we're getting there. So I think the COVID pandemic almost forced us to do that. So I think that's, again, a positive that came out of some of the sudden social distancing and the stay-at-home orders that came out then. And through this pause and this reflection, I think we were really able to use the skill of gratitude and appreciation. That's another strategy that I think we really have to use to get us through this COVID pandemic. And this is a great quote: "Finding gratitude and appreciation is key to resilience. People who take the time to list things they are grateful for are happier and healthier," right? So we have to take the time to think about the things that are making us happy, right? Things that we should be appreciative of, and things that we should be thankful for, right? So again, that power of the pause button forced us to take some time to reflect, and through that reflection, we are now learning to be thankful for and appreciate the blessings that we have, right? So I think that's an important strategy. And again, this is our diagram of wellness and burnout, and this is listed here: gratitude, appreciation, and reflection. And that could be reflection, could be just thinking about things, or maybe you're reflecting and you're actually writing it down and journaling some of your thoughts as part of the reflection process. So again, through this reflection, it allowed us to really take a moment to think about what all that we have, right? And be thankful for it and to appreciate it. And I think it allowed us to really realize that we have so many blessings in our lives that we take for granted. And the COVID pandemic kind of brought that to light because we could think about it. And and it was simple things, just being able to go to work and drive your car to work and go to the store or go to the restaurant or go to the gym or whatever it might be, right? That these are all blessings that we have had taken for granted, right? The fact that we thought there was going to be a big graduation party, when we graduated college or medical school or something, right? And that just changed and everything stopped all of a sudden, right? So we had taken that for granted, birthday parties and anniversaries and large weddings and all of this that we were looking forward to when we were planning. We were taking for granted that we'd be able to do that. But the pandemic has reminded us that those are blessings, right? That we take for granted, and we should think about those and be thankful and appreciate those blessings. I think also we were given the opportunity to realize that there's people that we take for granted, right? Because now suddenly we were not able to visit family and friends, right? We weren't able to see our parents or our grandparents or our cousins or our friends or our grandkids or whatever it might be, right? And we were taking for granted that we'd be able to see them, but now then suddenly with the social distancing and everything, we weren't able to see them in person. And we still haven't seen them for months in person then, right? So we were taking all this for granted. So again, we have to realize that that these are all blessings, and the people we have in our lives are blessings as well, and we should appreciate that and be thankful for that. Another thing that I think the COVID pandemic has reminded us of is that time is precious and life is precious, right? Again, we were just kind of going through our life and not thinking about things, and now we had a moment to pause and to reflect, and we realized that time is precious and life is precious. And we know with unfortunately with all the people that have passed away as part of this COVID pandemic, that again, time with them is precious and life itself is precious, and that many people have lost loved ones through this pandemic. And again, we assumed they would always be there, and we took it for granted. So again, make sure that we are not taking life and time with our loved ones for granted, but we are making an effort to spend time with them, to be with them, to appreciate them, be thankful for all that they have to offer, because again, life is short and time is very precious. And I think the pandemic reminded us of that as well then. Okay, so the next portion that we're going to be talking about is going to be flexibility, adaptability, and accepting change. So that's the next resilience strategy that I think is important to get through this COVID pandemic that we have to be using. So when it comes to flexibility, the people who are resilient are flexible, right? They know when to accept that which cannot be changed, and they positively reframe life's challenges, and they regulate their emotions, right? So again, resilient people are flexible, right? And we've been flexible through this pandemic, right? When we can't see people and friends and family in person, we've been using video conferencing or FaceTime and other things to do that. Or when we're working from home, so again, we're using video conferencing to do that. We've been very flexible in the healthcare system. We've been very flexible in doing more telehealth and telemedicine. So again, we've adapted and we've been flexible to this pandemic. We need to continue to be that way because resilient people are flexible. And people who are resilient, they're flexible in the ways that you think about challenges, and you're flexible in the way that you react emotionally to stress. So again, when you're resilient, you accept what cannot be changed, right? And you learn from difficulties and failures and stresses, and you grow from those scenarios. And then you use emotions like grief and anger to fuel compassion and courage, right? And then you search for meaning and opportunity in adversity. So you use these feelings to kind of encourage you and to motivate you. So again, we've had a lot of grief and anger and frustration and disappointment during the COVID pandemic, especially if you've had family members who have been sick or have passed away from COVID. There's a lot of those emotions and a lot of those feelings, right? But we need to be flexible and we need to reframe things and see if we can try to use those feelings to fuel further compassion and courage, right? So maybe now you're helping other families in need who are struggling through this difficult time with health care issues or financial issues or food insecurity, and now you're using your grief and anger to be more compassionate, to help them. so that they don't have to go through some of the difficulties that you might have gone through. So again, using these type of skills to enhance your resilience and get through this difficult time. So again, part of flexibility is acceptance, and acceptance really enhances resilience. And acceptance allows you to tolerate highly stressful situations. Acceptance is not the same as resignation. It does not involve giving up or quitting. Acceptance is based on realistic appraisal and active decision making. So again, we've had to accept a lot of new things and the new norm and the new reality related to the COVID pandemic. And again, we've had to accept changes in job situations. We've had to accept the fact that there's different financial insecurities that we have to go through. We've had to accept the fact that loved ones have gotten sick and maybe loved ones have even passed away. So again, we've had to accept that is happening. And again, acceptance and trying to move on from that is part of resilience. I know it can be very hard. It can be very difficult when you've lost a loved one or something really tragic has happened. But we need to be able to try to move on from it and try to develop resilience and accept it and help us move on from it. This is a great quote. Acceptance is the peace that comes with letting life happen without forcing it, right? So acceptance is the peace that comes when you just kind of let life happen, right? We try to force life, right? We feel that it has to happen this way and that the outcome has to be this way. And, I'm planning it this way, so it has to be this way. And we kind of force things, right? And sometimes that really adds to stress and anxiety and the risk of burning out, right? So we just need to do the best we can, right? Plan the best you can and do it the best you can, right? But don't force it. Just let it happen and things will happen. Things happen for a reason. Everything happens for a reason. We just need to let it happen. Do the best we can, work hard for it. But then, let it happen and then just accept what the outcome is going to be. And that creates a peace because you're allowing things to happen and you're just accepting it that it happened that way for a reason and that there is a good reason for that outcome. And you might think it's a bad outcome at the moment, but down the road, you might realize that it actually was a good thing. At that moment, it looked terrible, but down the road, it turned out that that was actually a blessing in disguise. So that's part of being flexible and accepting what is happening. I think that's a very important part of responding to the COVID pandemic then. Okay, so as we wrap up here, again, this is our overview of the wellness and burnout diagram. I just want to briefly highlight, we're not going to talk about all these, but just briefly highlight a lot of self-care type of activities. And these are very important resilience strategies, especially during the COVID pandemic. We have to make sure that we are taking care of ourselves, and we have to really provide self-care, right? And that could be making sure that we are eating healthy and eating nutritious, and that we are making sure we're getting adequate sleep, and that we're not fatigued. And maybe it's working out and exercising to take care of ourselves and to reduce some of that stress on our mind, and also to help us in our physical bodies, right? And maybe it's different things. And again, these are all very this is not all inclusive, but they're very broad categories. And for some person, some of these activities are going to be very helpful, and for other people, they might not be that helpful. But I think it's important for everyone to identify maybe 2 or 3 things on this list or other lists to really work on and to use as specific resilience strategies for yourself to help you get through this pandemic. So again, for some people, it might be mindfulness and meditation and relaxation techniques, or deep breathing and yoga, right? So for some people that might be effective. For some people that might not be. So then you look for other things, right? So maybe for other people it's sports and hobbies, and others it's arts and crafts, and for someone else it's nature, and for someone else it's music and reading, and for someone else it's faith and spirituality. And I think it's important to always have a daily release every day, meaning that every day you have set aside time in your day to do one of these activities, to do something for yourself, right? And so it might be to read something, it might be to do some yoga, it might be to do some mindfulness, might be to pray or something, right? So whatever it is, take a moment every day to release your stress and identify something for your self-care. So I think it's so important for everyone to identify 2 or 3 things and to do them on a daily basis or a regular basis to help to enhance your resilience to get through COVID. And again, it's different for everyone. So for somebody, some things work, and for someone else, other things might work more effectively. But you have to identify what's going to work for you, and really work and find time to do those self-care activities that enhance your own resilience. Okay, so to summarize here, so we've been talking about different resilience strategies and self-care strategies and the wellness dimensions as part of ways to maintain wellness during the COVID pandemic. So I just kind of provided an overview of some of those strategies. And in other videos, I go into more detail about some of the things that we talked about in this video. For example, positive thinking and reframing optimism. I go into more detail about those in other videos, so you can view those. So I just wanted to provide an overview of some of the strategies that could be helpful in maintaining wellness through this this COVID pandemic. So hopefully you'll take advantage of some of the other videos that go into some more of the details of these different strategies. So I want to thank you for your time and hope that you found this this video helpful, giving you some strategies, how to maintain resilience and how to maintain wellness to get through the COVID pandemic. And again, we're going to get through it. We just have to keep faith, keep hope, stay optimistic, be flexible, be accepting of what's happening, and realize that it's a marathon that we're going to get through. But we all have to do our part. We all have to do our part in keeping everyone well, whether it's physically well or mentally well or emotionally well. We have to all do our part. So hopefully we'll all continue to do so, and look forward to you viewing other videos on this topic as well.